for a conversation produced by our underwriter, CenterWell, about how to age well in America, please welcome Sanjay Shetty, President of CenterWell at Humana, with Candace Montgomery, Executive Vice President of AtlanticLIVE.
Good afternoon, everyone. So, Dr. Shetty, let's jump right in.
Yeah.
Let's start with the big picture. What do you think is fundamentally missing from how our health system supports people as they age?
Short answer, so much. There's so much broken with the system as it exists. If I'm starting out, the most fundamental problem is that our healthcare system is designed to treat illness. We are woefully under-resourced when it comes to actually managing preventive, proactive, holistic care. I'd say the other big problem is it's incredibly fragmented. It's over-complex. If any of you have had family members who've had to navigate the system, I'm a physician and I've had to navigate it for my own parents, it is incredibly difficult to navigate as a patient. But this is a thing we have to figure out. As we all know, seniors represent a huge and quickly growing segment of the population, expected to be 80 million people by 2050. And they're a different kind of person. If we look at their medical conditions, 93% of seniors have one or more chronic conditions. 79 have two or more chronic conditions. So it's absolutely vital that we figure this out. But if we go a little deeper, we spent some time recently trying to get to know our patients a little bit better. We recently published the CenterWell Aging Well in America survey. And we learned a lot of really interesting things. I'd say one of the insights that I really appreciated was when we asked Americans, 2/3 of Americans said they would prefer independence to living longer but being dependent on someone else. And that percentage increased to 78% when we asked seniors. Independence is so important to the people that we're serving. And obviously I'm a doctor, so I orient to physical health, but obviously the worries on people's minds were much broader than that. People are worried about financial insecurity, mental health, loneliness and isolation. So the needs of the population that we're serving are much broader. And so I'll just back up. I'll tell you a little bit about CenterWell. We have the honor of sponsoring this session today. We're probably a little bigger than you realize. CenterWell is the care delivery organization at Humana. It includes CenterWell Senior Primary Care, which is about 330 senior-focused clinics operating in 15 states. We have CenterWell Home Health, one of the leading home health agencies in the country, operating in 37 states, and CenterWell Pharmacy, a home delivery pharmacy and specialty pharmacy. And I would say all of what I just described to you, everything that I think is broken, is really what has informed what we're trying to do different at CenterWell. We are very much leaning into this idea of normalizing proactive and preventative care. We want to ensure that our patients have the time with our providers to learn about their health and to engage. We want to make sure that we're addressing all of the other barriers that are in their life, these socioeconomic, language, cultural barriers that's allowing them to achieve their best health. And so that's the model that we're really leaning into. So lots to fix, but we're excited to try to be part of the solution.
Yeah, it's very fascinating. When we talk about aging well, can you reflect on what it really encompasses and how factors beyond physical health shape fulfillment later in life, as you were saying a few minutes ago?
Well, one really important thing is, aging well doesn't mean just living longer, right? It means that those later years have to be full of fulfillment and sort of lived on your own terms. And so we actually wanted to learn more about that. So we are working now on what we're going to publish in a few months, which is the CenterWell Index on Fulfillment. And it's trying to get at the heart of what it is our patients really want. And in some ways it's insightful, in other ways it's not surprising at all. I'll tell you a little bit about it. At the top of the tier of what makes a senior feel fulfilled are two important things. One is that feeling of being comfortably secure. They want stability, they want peace of mind. The other one is they want a sense of purpose, right? They need to have meaningful role or goals or contributions. That's at the top. Below that are the ways that they approach life. So what drives fulfillment? It's sort of your sources of strength, whether it's optimism or gratitude or spirituality. And it's only below that that you see sort of the rest of what informs being fulfilled. It's financial security, it's social connectivity, emotional intimacy, validation, and physical health. So it is a pretty broad set of items. And a couple of interesting things fell out of that. One was there's actually a dip in fulfillment at the ages of 66 and 67. Lots of reasons. We were trying to dig into that on the why, but you can start to hypothesize the reason, right? Those folks are coming out of the workforce and now trying to figure out what to do in this new thing called being a senior. After that, fulfillment continues to increase. And so we just see this dip that we're trying to sort of figure out. How can we help support people through that dip? The other thing is it kind of points again at where the medical system is kind of failing us, right? A patient can be going to multiple doctors across many different settings, and nowhere they're getting that advice. How do I find my independence? How do I attach to resources that could help me through this? So yet another way that I think we have to do better as a healthcare system.
You've spoken before about the need for a more integrated, team-based approach to care. What does that look like in practice, and how do we change that experience for older adults?
Yeah. Well, one of the things, it was actually just published in the Journal of Multidisciplinary Healthcare, a really good systematic review that talked about the power of interdisciplinary team-based care. What that means is people from different disciplines getting together to really think differently about how we care for a patient. It's something that we do at CenterWell Senior Primary Care. So while we obviously have our doctors and our nurse practitioners, every one of our patients also has access to a community health worker who can visit them at home, a pharmacist, a behavioral health specialist, care managers who are helping them navigate various points in their care. All of that is incredibly important because we're trying to take the mystery out of navigating the system, and we're trying to make it clear that you need a village to really take care of every one of these patients, and it goes well beyond the physical needs of what you're getting in the office itself. And it manifests itself in lots of different ways. I would say one of the really cool things is what we see within the primary care office, but it actually can extend beyond that. I mentioned that CenterWell has these other businesses, home health and pharmacy. We recently had a patient named Joanne who had a hip injury, and she was being seen actually by all three businesses at once. So she was getting her home delivery meds because she couldn't go to the pharmacy anymore from the pharmacy. She had a CenterWell primary care doctor and a CenterWell home health nurse who was really trying to get her back to achieving her goals, getting her walking again. And I couldn't believe it because she referred to it as CenterWell is taking care of me. That just doesn't happen. You don't see a place where a patient is actually saying, that's one team surrounding me and taking care of me, right? I can tell you in real life, that is an intermittent conversation. Believe it or not, sometimes it's a fax going from one place to another. So the system is so fragmented. And I just want to comment again on the power of the home. I spend a lot of time riding along with our home health nurses because I'm just fascinated by what we can learn about our patients when we see them outside the setting of the clinic. I'll share one example that happened not too long ago. We had a patient who was having frequent infections, and we couldn't really figure out why. In the clinic, the story wasn't clear. One of our nurses went and visited her at home. And the nurse realized, and I was with her, that we realized that the primary caregiver for this patient was her son-in-law. And so she was too embarrassed to take a shower. And so the intervention that we had to prescribe was a shower chair and a technique for her to take a shower where she could preserve her dignity. Such a minor intervention that now we're reducing ER visits, right? And it's just that unlock when you say, wait, there's a whole person here that we didn't see when we were just thinking them as a person in the clinic.
Absolutely. What would it take for it to move from today's fragmented system that over-indexes on medical intervention to one focused on preventative care and well-being, including healthy aging, education, and social and emotional support?
Yeah, I think this is the key question. McKinsey Health Institute actually just published a study showing that interventions that focus on healthy aging have an amazing return on investment. You know, typically $1 invested in healthy aging gets you $3 back, both in the context of reducing medical cost, but also in improving overall economic benefit. So the interventions are varied. It can include transportation, social connectivity, physical activity. In fact, some of those are interventions we do. Every one of our primary care clinics has a community room. We throw activities. There's dances, there's dominoes, there's all sorts of things going on where we're trying to pull people together. And it's just, you realize how important that can be. So that's one. But I think it raises a couple of other issues. You can have that model, sounds great, but there's a big crisis of primary care in this country. And so I want to speak to that just a little bit. When we looked at our survey on aging, we saw that over half of seniors are not seeing a primary care doctor regularly. And yet, when asked, they said the primary care doctor is the single factor most likely to help me age well, followed closely by their family. So there's this massive disconnect. Even worse, we looked at the population right below that, ages 45 to 64. Only about a quarter of them are seeing their doctor regularly. So a huge unlock that we could get if we could promote longitudinal primary care. And just to reiterate what you said, the social and behavioral part are so important, right? So we've invested in connectivity in our clinics. There's so much more we could be doing. The Surgeon General has told us that isolation can lead to be a risk factor for dementia. So it is just so important for us to continue to think about how we can improve access to those type of activities.
As we close here and look ahead, how should society be thinking about aging? And what unique roles can individuals and communities, as well as organizations, play in creating healthier, more fulfilling experiences for our future generations?
Yeah, well, I think this is going to be very much a team sport, right? We've talked about how the medical establishment can only do a part of this. I would say, first, as a society, we have to pivot our view on aging, right? A session like this is perfect for that. We have to continue to change the view. Second, we have to invest in primary care, change the view that primary care is a transactional thing, like a visit to an urgent care is enough, to being a longitudinal relationship that we can depend on. And then going forward, we've got to just keep thinking about it as being a set of solutions that will address fulfillment more broadly. So excited to be part of the answer.
I believe that. Thank you, Dr. Shetty.
Thank you very much.